Is there anything we can do as a group or individuals to lobby for change in the organ regulations?
Well, I mean, this always comes up. I think the issue of the opt-out, opt-in law, I'm not too despondent by the role that the advice that was given and subsequently taken. The government have taken the view that they'll review the opt-out, but I think the concentrated effort ought to be to maximise what we've already got. There is actually an unused resource. There are now the change is that every hospital will have a non-hospital person, not employed by the hospital, it's a national position, to request and to skillfully discuss. And the important thing is to make sure that system is working well. And in other words, potential brain dead donors, the families are being asked appropriately, and that system is working. And moreover, intensive care units will manage and will try and maximise organ donation, and that means looking after the patient even after that patient has been declared brain dead and is going to be a donor. It causes quite a lot of ethical issues, but the majority of medical practitioners regard giving medicines after brain death to preserve organs, to allow more patients to live, is ethical, not to give treatment because it's of no longer any benefit to that individual, even though they're brain dead. But there are some doctors who take the other view. And yet we know that there are very simple mechanisms and drugs that can be given that will maximise the use of organs. And it's that sort of lobbying, and it's making sure that in all your local hospitals, the intensive care units are pro organ donation, and that you can the United Kingdom transfusion, or blood transfusion and transplant service now is putting in a whole cadre, if you like, of donor coordinators whose role will be to ensure that those difficult questions at the time of brain death are asked of families, whereas in the past that hasn't always been the case. And I think the effort in terms of both doing that, making sure that best practice is given to the brain dead donor to maintain organ function is going on, and that the resource into transplant units to utilise those organs is in place. So yes, it's UK. The 5th of July is UK Transplant Week, and there'll be lots of activities going on. So plug that and the joy. And I'm actually a trustee of the Transplant Trust. One of the things I've been thinking is we're a trust not in as good financial shape as yours, I have to say, sadly. But we're a sort of a bit of a rebirth of this trust, and I think we should be talking to a bit more to patient health groups like yourselves, and perhaps channeling, giving you the information to do just what you do. How can you be most effective in working with us to end up with what we most want to achieve? So I think that's something we can probably take forward from this meeting on a broader view, which would be, I think, positive.
I just want to say thank you to Paul for an absolutely fantastic talk. We'd all agree, and also for answering your questions so thoughtfully. And, we've tried to get Paul, as you heard, for some time. You see now why we've been so keen. And it makes such a difference, Paul, to have somebody with your expertise and experience. And thank you for telling us about the new developments and also about the thinking behind the strategies and the changes that are being made to transplant. I think it's very interesting to have that insight. So thank you very much for giving up your Saturday. And I think we'd also, or I'd like to, on behalf of the LAM patients, thank you for building up the unit in Newcastle, because I know with other people, but I mean, I was a student in Newcastle, and it is a few years ago, but respiratory chest medicine was the poor relation at that time, and the reason I got into chest medicine was because I realised my education would be very poor in that area, so I went somewhere else, and Newcastle has changed out of all recognition. It is now one of the leading respiratory centres, that's enough, leading respiratory centres in the UK. And a lot of that is due to Paul's energy, and obviously the transplant programme has been on the back of that. So thank you very much for that as well.